So kia ora koutou. My name is Justin Butcher and I'm the CEO of Pinnacle Incorporated.
Kia ora koutou, Craig McFarlane. I'm the independent chair of Pinnacle Incorporated.
So how we'd like to run this today is we've got a pre-prepared statement that we'll read, followed by the opportunity to ask some questions. So on Wednesday last week, Pinnacle Midlands Health network experienced a cyber attack that impacted some of our IT services. This included services delivered to Pinnacle Group regional offices and primary healthcare limited practices across Taranaki, Rotorua, Taupo-Turangi, Thames Coromandel and Waikato. As soon as we became aware of the incident, the affected IT system was taken offline and contained. We engaged external support partners and launched an in-depth investigation alongside relevant authorities. Following the initial investigation, we are now aware that malicious actors have breached our system and have accessed information which could include commercial and personal details. Pinnacle has laid a complaint with the police and we are working with Te Whatu Ora and other government agencies. At this point in time, we cannot confirm what specific data may have been accessed, but we are working through a process to better understand this. This will take time. However, we believe it is important to disclose this incident now, and we will support those people who have been potentially impacted. The affected practices remain operational. However, patients may experience some delays when contacting their practices. But the key message is, if you are needing care, please call your doctor or medical centre as you normally would. We do not hold your GP notes. These are kept by your individual medical centres. Things like your notes made during consultations are not at risk. However, we do have some personal information such as names, addresses and NHI numbers. Pinnacle takes our role as stewards of people's information seriously, and security is of our utmost importance to us. Unfortunately, malicious cyber activity is a constant threat and New Zealand is not exempt from this. We have notified the Office of the Privacy Commissioner. We have plans in place and we are working hard to understand exactly what has happened and who may have been impacted. We know that people are likely to be concerned about their information and are setting up an 0800 number later today for people to contact. We will also update our website, www.pinnacle.co.nz, when we have further information to share. While we do not have all of the details, we encourage you to be vigilant to any unusual online requests. CertNZ has more information about staying safe online on their website. We are at a relatively early stage in our response and are not in a position to provide further details at this time. So, happy to invite any questions.
How many patients do you cater for across your entire network?
Yeah, so Pinnacle looks after a network of 87 general practices with approximately 450,000 patients.
And I know that it's still early stages, but do you have any indication of how many of those patients could potentially be affected?
No, at this stage in the investigation, that information isn't available, but that will form part of what we're looking at.
Were these malicious actions? Have the people involved asked for a ransom?
So we do believe this was a cyber attack, but at this stage of the investigation, I can't comment on the malicious actors.
Are they actually threatening to release some confidential information?
At this stage, as I said, I'm not in a position to comment on that.
An IT expert has said people, patients should be prepared for their information to be uploaded onto the dark web. What would you say to that?
I think, as we've mentioned earlier, it's important for patients to be vigilant about any unusual online activity, but we don't know exactly what these attackers are doing, and that will form part of what we're looking at.
How long was your system under attack, essentially?
Again, that's forming part of what we're looking at, but it was a relatively short period of time.
What made you first aware that something had gone wrong?
Some users reported devices resetting.
And how long do you imagine that the investigation is going to continue for as well?
That's a really good question, and that's a question we've asked of our cybersecurity experts. So at this stage, that's with them and we're working with them.
Do you imagine you'll be giving daily updates or weekly updates? Because I understand that those patients might be a bit concerned.
Yeah, look, absolutely we understand the concern that patients will have. I think it's probably really important that a lot of our staff are patients in these medical centres too. So for me, my family is a patient to one of these medical centres. So we will continue to put updates out as regularly as we can via our website and respond to any other requests. But again, we will have that 0800 number for patients that are concerned.
And in the meantime, what have you done to boost the security systems to ensure that there isn't another breach?
Yeah, so we've taken a lot of steps through third-party cyber experts. At this stage, the IT environment is being brought online in a very cautious approach under those guidance. So that will be our way. We will just continue to take advice from those experts.
How long will that 0800 number be open for people to call?
We haven't made a decision on that, but realistically, as long as there is a need for it. So we'll assess that as it goes. Okay. Thank you very much for coming.